So thank you all for joining us today for this discussion on recasting our systems boundaries post-COVID-19, or as we could recall it, during COVID-19 still. And we're hoping to explore how some of the initial adaptations we've made to our WASH system strengthening work are contributing to make the case for changes to other systems and sectors, and will do so going forward, of course, as the pandemic progresses. So such as the changes we're seeing to health systems, to the education sector, to how government manages its own work and its different systems and processes. So this particular event is a third discussion in the Systems Learning Exchange series and builds on the previous ones we held in June, which was on WASH systems and emergency response, and then in July, which was focused on strengthening WASH systems, the new normal. And you can watch the presentation videos and webinar recordings on YouTube if you missed those previous events. So this exchange is all about peer learning, where we as WASH practitioners want to have more conversations and learn amongst ourselves. So really it's an effort to bring together different Agenda for Change members and countries to hear about the different activities going on in different places and to share the lessons learned. So this, hopefully, if you can see the slides, let me see if I can see. This is our agenda for the day. We'll have a few more introductions to our speakers, and then we'll hear a little about Agenda for Change from Susan, the Global Coordinator of Agenda for Change. I'll introduce our speakers and recap on the video presentations that they gave, which hopefully you've had time to watch. We'll have a panel discussion. We'll ask for your feedback, and then we'll conclude with an overview of next steps as well for this learning event and this learning series. So on the next slide, you should be able to see the details of who's who. So I've introduced myself, of course, and we've also got Susan Davis and Alec from Agenda for Change. We have Sovattha and Geoff from WaterSHED in Cambodia. We have Dora from Splash in India, and we have Francois and Bezout from Catholic Relief Services in the DRC and Madagascar, respectively. So you may also be able to see them on the videos, and they'll be speaking individually in a few short moments. Okay, so first of all, I'd like to hand over to Susan to tell us a little bit more about Agenda for Change. Thanks, Susan.
Thanks, Tracy, and welcome to all of you. Just a reminder, if you're just joining, to choose your language at the bottom where it says interpretation. Even if it's English, you need to choose that because we do have some French speakers. So who is Agenda for Change? It's a collaboration of like-minded organizations, currently 14 members, and you can see their logos there. They share a set of principles and approaches towards what we call system strengthening for water, sanitation, and hygiene. We're all working together to strengthen local governments, national governments, so that they can do the jobs that they need to do to reach universal access to water and sanitation. Our members are currently working on system strengthening approaches in more than 40 countries. And their approaches can look different. They might be working at the district level, they might be working at the national level, they work on policy, finance, service delivery, and a whole variety of approaches, sometimes combined. And they often work in collaboration with each other. The blue countries that you can see on this map are places where we're actively pursuing deeper collaboration among Agenda for Change members. Our key activities as a collaboration are to compile evidence, and we have a really exciting consultancy going on right now where they're compiling the evidence of stronger systems from across our membership. We do collective advocacy, and we're working on some of that around specifically using a systems approach even during emergencies. So you can imagine we have a lot of examples currently with the COVID-19 response, and you'll hear about some of them today. And then we also do knowledge sharing, and this is one of our, I hope, shining examples of trying to engage people from around the world and share their lessons and challenges with each other and with you.
Thanks, Susan. Really good overview of Agenda for Change and the different activities that you're doing. So Next, I'd like to invite our speakers today to tell us a little bit more about their videos. Hopefully the audience have all had an opportunity to watch the videos that we prepared in advance of the discussion today. You can see those on YouTube. And we're not going to watch those videos here today, but we will hear a 2-minute recap of the key points from each speaker. So I will invite each speaker again to remember to unmute and then mute themselves again. Always a challenge when we're all on Zoom. Okay, so first of all, I'll ask Dora, please can you tell us in just 2 minutes a quick recap of your presentation, which was all about working with government on wash system strengthening post-COVID-19 in Kolkata in India. Over to you, Dora.
Thanks, Tracy. Hello, everyone. Greetings from Kolkata. So yeah, quickly recap, project-wise, it is Washing Schools for Everyone. It is a program that, again, it's a very ambitious program trying to reach out to about 1,200 government schools in Kolkata with water, sanitation, hygiene, and strengthened menstrual hygiene management services. As you can imagine, this project is even more relevant than it was earlier. However, we face challenges. In the current environment, there are conflicting priorities for the government, managing the pandemic and its after effects, state elections coming next year, and recovery from Cyclone Amphan. Meanwhile, Splash and our partner schools are also facing renewed infrastructure supply challenges as we prepare to embrace the new normal of social distancing, among others. So we have taken up this challenge, and we are looking at redesigning the program with a focus on using, for example, digital platforms for the behavior change related inputs, whereas we are also exploring design changes to existing water and sanitation hardware to be able to address the standard operating procedures that are being released by the government and international collectives in relation to schools as they reopen. We are also looking at scaling the project, which means that we have to be looking for greater funding and buy-in from the government, including co-funding. With the shifting government priorities, this is harder, but we believe it's not impossible. And Splash's intervention has already been acknowledged by government stakeholders for its contribution towards ensuring better wash facilities in schools. So we have done training for the government teachers on the behest of the government. So we believe that there is quite a lot of encouraging support from the government already, and we are looking for more. But at the same time, we are also we do believe that there is a need for collective effort to ensure that the schools are equipped to handle the new normal. And it's not going to be easy, especially with the real estate challenges. But we believe that increased awareness, tweaked infrastructure can help lower those risks. And this is a very good platform wherein, while we talk about our experiences, we get to learn a lot more from others who are here. So here's hoping that we get to a point where we know better and we are being able to support the work that we are doing.
That's great. Thank you so much, Dora. Perfect. And next I'd like to invite Francois and Bezout, who will be talking in French. So please, everybody listening in English, make sure you are on the English channel. Francois and Bezout, if you would like to tell us a little bit more, please, about the presentation you shared with us about achieving improvements in wash and healthcare facilities in DRC and Madagascar, please.
Merci beaucoup.
Thank you very much, Tracy, and good afternoon to everyone. So here in CRS, we are quite ambitious. We want to help governments to improve the wash systems in the health centers, health facilities. So we have a program that exists in different countries. But here we'll cite, for example, Burkina Faso, Ethiopia, Madagascar, and the DRC. So we are the participating countries. We have 2 flagship projects that we are now busy with. in Madagascar and in DRC. In Madagascar, we have the funding of SIED, and we are dealing here with the health facilities. And we also have the project for funding of the Foundation Wallace, which gives us fund to support health facilities throughout Global Advent. And with these different structures or organizations, it is now almost 1 year that we work with the different teams in the health facilities, in the district, in the hospitals, to build capacity. We do training, we help them to develop improvement plans. And we also have some monitoring and evaluation mechanism. And what we want out of this, well, we want to achieve cleanliness in the health facilities and in hospitals so that women and children who come to these facilities be in fact treated without any risk, so that they are not at risk of getting infections. We are quite happy to be here today, so we can discuss this issue of capacity building and strengthening the systems, and also to discuss what is happening in the health facilities centers. Thank you very much.
Thank you very much, Francois. And we'll hear more from Bezout when we come to the questions, as he's representing CRS in Madagascar. Okay, so next I would like to invite Sovattha and or Geoff to tell us a little bit more, please, about your video presentation from the Watershed experience in Cambodia, where you've been talking about system strengthening and strategic exit strategies. So over to you. Thank you.
Thank you, Tracy. And we share the role. So Watershed Design, all our activity, indeed, the whole program, from the beginning with an exit in mind. We evolved from the pilot program in phase 1 from 2009 to 2011 as the pilot of our market-based sanitation project. With phase 2 in 2012 to 2017 as the scale-up program of the core market building program and engaging local government actors in order to sustain the program. And phase 3 from 2018 to 2021, just another extension of 6 months to implement the exit strategy to ensure the sustainability. And this is where we ensure government ownership of key roles in market facilitation, multi-stakeholder coordination, and data collection and monitoring. Geoff will add a bit more.
Thanks, Sovattha. Yeah, Geoff here. And I'll just add on to say that we're sharing essentially a perspective of 10-year kind of journey or life cycle of an organization as we changed over time working on system strengthening. And 2 assertions that we can put forward that might draw some distinction between our conception of system strengthening with, compared to others is that, one, this idea Sovattha mentioned and we talked about in the video, seeing that our exit as being kind of the logical extension of system strengthening or the eventuality of it. And also we put emphasis on the actors. We know that there are discussions about building blocks and components of the system often viewed as factors and actors, factors being things like policies and institutional arrangements and financing. But we've always emphasized much more the actors because the actors kind of make the factors and write the policies and design institutional arrangements. It's a debatable point, but it's something that, is a perspective that we'd like to bring into the mix. So that's it from us.
Great, thank you, Sovattha and Geoff. And also these factors and actors, that just reminded me, that very sentence was a phrase that also Bezout referred to in his presentation on Madagascar, which in turn reminded me, and she's also here with us today, to say thank you to Agnes Montenegro from Helvetas, who helped us do the French interview with CRS. So thank you, Agnes. A little shout out to you there. So thank you all for providing those really clear and concise overviews of your video presentations. And what we'll do next then is start to talk about some of the issues, the questions that came in from the audience in advance of the discussion today. While I just look at my questions for a moment, I'd also like to encourage the audience online with us today to start submitting your questions through the Q&A. And as I mentioned at the beginning, if you see a question that you think is really pertinent and is really important for the actual discussion, please vote that one. But you can vote up the questions that you're most interested in discussing. We will come to all of those questions. We'll ask our speakers to address them in writing afterwards, but specifically for the ones that you want to hear live in this live discussion today, please do vote for them as we go. So I hope that makes sense and that everybody can see that option on the screen. I know we don't have any questions there yet, but hopefully we will soon. Okay, so first of all, I'd like to ask a question, please, to, well, firstly to Sovattha and Geoff, and then I'll come to Francois and Bezout also. But one of the questions really started to ask about how we deal in the longer term with different institutional arrangements and accountability. And that question is, and I shall just read it from our participant. A challenge often described in system strengthening is about turnover of key stakeholders, especially government staff. They may be promoted or shifted to another region or moved to new organizations. And of course, the time and resources and frustration of needing to then start again with someone new is something that we all experience. So I wanted to ask the panel, how do they view this? Can this also be seen as an opportunity to recast the boundaries of our systems? So how do we deal with this kind of turnover and the ever-changing system and the people within it? So first of all, over to Sovattha and Geoff, if you could share some thoughts on that one, please.
Yeah, sure. Well, I'll go ahead. Sovattha, please feel free to add on. There are a few levels to this questions. It's critical. I mean, especially the emphasis I just mentioned on actors. People do turn over, and that can be frustrating. It's kind of something we've thought about. Certainly, like not putting all the eggs in one basket, to use an idiom, not to invest all our effort into one person. And then everything depends on one person or even one department. But we have to strike a balance between sort of working across a wide group of people with also limited time and resources, and is that really our role anyways? But a couple things that we've done, we did a pretty in-depth network analysis, which is an interesting way. It was new for me to understand who are the actors in the system. And with that exercise, we did deliberately cast a very wide net to see all the different players other than the usual WASH suspects that kind of underpin our success as a sector. But more than that, I learned that the kind of network analysis can show us about the relationships between individuals and institutions, who are kind of nodes, who bridge different subgroups, who are really important nodes of communication, trust, information sharing, the direction of that. So lots of interesting stuff there. I won't go on about it, but it helps us target strengthening efforts with respect to the networks. But the second point I want to make is maybe even the more critical one. And we talked about in our video the Civic Champions Leadership Training Program, which is something Watershed spent a lot of effort on. And the fundamental idea of that program, Civic Champions, wasn't to train commune councillors or other government officials. It is the core of the program, but what's, I think, most exciting about it is that we work mostly on institutionalizing that system of training and leadership development within the government system. So we know the elected officials or even appointed officials, civil servants are going to change, and we have to design for that. And so institutionalizing within the government system means that newly onboarded staff are brought into that system and are trained and coached over time. And I won't lead into, I know one of the future questions about allies comes up. And I think having allies helps us also with respect to this challenge, but we can save that point for further discussion.
Thank you, Geoff. Did you want to add anything to that, Sovattha?
No, thank you, Tracy. Geoff already speak my mind on Civic Champion program. Thank you.
Great, thank you. Well, I'd also like to come to this point to Francois and Bezout as well, because I know you both described the different actors, the different stakeholders that need to be involved and how you're working with them, but that turnover is an issue in your context as well, and including for staff. So it would be great to hear from you as well about how you can also see this as an opportunity.
Oui, merci beaucoup, Tracy.
Thank you very much, Tracy. So I think in all countries and in all developing countries, there is this problem of a very high turnover in the team. So to strengthen the systems, what we have done, we've done training of the different teams in the clinics. So both medical staff and non-medical staff. So we trained these teams, but we also strengthened the monitoring systems in terms of the personnel's performance. So with the head of the different health facilities, we saw to it that there was a succession plan. We saw to it that there was a way for supervisors of knowing that they might have to occupy the post higher than their level in case there was a change in staff. So that was an element that was missing in the different hospitals and health facilities we worked with. And today we can see that it's working. Everyone is satisfied. When we changed the way of managing staff in terms of capacities, we saw at the level of districts as well that we could reflect together in terms of the different devices that could be implemented to obtain better stability in terms of staff, because often the change is not about salary only. Sometimes the changes are linked to the leadership. So perhaps someone could have a leader that doesn't really support them, or they don't feel supported. So they want to change team, change organization. So we are really trying to consider the different possibilities. We are looking at different ways of managing. We want to make sure that the managers are indeed taking into account the human rights, the well-being of their staff, and think about their staff in that manner, in that holistic manner. So to complement what Francois just said, so the transfer of knowledge and of experience is necessary. We work with local organizations. So we make sure that if someone has to leave and someone else comes, we make sure that there are some criteria. And we also make sure that health facilities have strong systems in place to transfer knowledge to the teams and to the community organizations as well. So at all levels, so that competencies are transferred. So at all levels, there's new staff joining, some staff leaving. So we have some systems in place. We make sure that there is a sharing of knowledge between the different health facilities, and we make sure as well that the different systems are used. Thank you.
Thank you, Francois and Bezout. So next, well, I've taken quite a few ideas and notes there from how to address this turnover question. We will make sure we capture these in a note afterwards as well to share with all participants and beyond. But another question that came in specifically for Dora that I'd like to come to next was around how COVID-19 has cast doubt on the school feeding programme, as schools can't guarantee their safe food provision or adequate hand washing facilities. And so the question for you was around how can NGO actors like Splash use COVID-19 and these sector discussions to catalyse systemic change? So over to you, please, Dora.
Hi, thanks, Tracy. I think in this case, it is a good example for how the government has responded the issue at least in the short term, by kind of distributing dry ration but as we prepare for the school reopening, all stakeholders need to work together. Splash, for example, is, as I mentioned in my presentation also, is looking at design changes to ensure better access to hand washing. But then there is the need for the government and the immediate stakeholders from the school to look at greater access, especially to water supply, for example. Facilities to ensure hand washing and sanitization is happening periodically. For our, as I mentioned, our behavior change program is going through a change. We are currently reviewing this to sort of, bring in sort of like trying to address issues around COVID-19. And this is it's kind of a very well-timed review that we are working on currently, wherein we are looking at not only taking into consideration our own internal discussions, but also we would be talking to the government. And like we did in our previous curriculum development work, where the government representation and was there and their feedback was sought, we are going to do a similar exercise so that, the schools, once they reopen, they are sort of better prepared in terms of addressing this. And I think a forum like this allows us to learn also in terms of how people across the globe, like-minded people, are reacting and kind of, changing in terms of these renewed needs and how they are addressing them. So I think this, while we are doing a lot, or at least in our small way, we are doing it, but there is a lot to learn also from others present here. Thank you.
Thanks, Dora. And that leads us nicely on actually to an additional question that was asked around financing. Because as we are all reacting and changing, adapting our activities, how do we actually finance that? And a specific question that came in was around the lack of government funding. And this obviously becomes more acute with different crises and when there are other urgent spending needs. So if you need to fund something with your program, such as a training program or behavior change campaign or anything, because of a new or unexpected lack of government funding, in our current case being diverted towards COVID-19 as well, how can you try to overcome this, and how do you provide almost a temporary backstopping of funds rather than becoming something that funds something in the longer term that is indispensable to your work and then therefore becomes unsustainable because there's again this lack of government funding? So I'd like again to ask maybe Sovattha and or Geoff to reflect on this finance question first of all. How are you addressing that in the current context? If there are new demands coming in and fewer government funds available.
Thank you. I would like to take this question. So it might hard to say across all countries, But in a growing lower middle income country, there are two things. We are a development actor, not a humanitarian relief agency. In case of crisis, we just need to approach donor ourselves. So ideally, our government counterpart would do that directly, and we are not compromising our position as a system strengthener. For system strengthening, building capacity of local actor is one of the cheaper investment government can make as compared to massive infrastructure project. If funds are cut for coordination meeting, we would submit that it's likely a prioritization problem rather than through bankruptcy. If it's bankruptcy, then humanitarian aid agency can come in. In the past, development agencies have been far too willing to support on a temporary basis, and it seems nearly always to become indispensable. We use the word discipline in describing our work a lot, probably to the point where it sounds strange, but it's partly for this reason. The only way to be sure that temporary funding doesn't become indispensable is to simply not offer it. Thank you.
Thank you, Sovattha. Geoff, did you want to add anything to that? Fine.
No, thanks, Tracy.
Thank you. Okay, so next of all, I can see some questions that are starting to come in through Zoom, and they are also being voted on, which is great. So while the audience are taking a look at those and voting, I will just ask one more question, which is, let me see, we have a nice long list that was submitted in advance. So perhaps next I'm going to come back to Dora and to ask you, Dora, when we're talking about recasting our boundaries beyond WaSH systems, you mentioned already that you've been working closely with government and those in the education sector. But could you tell us a little bit more about how you've been collaborating with these different actors? What does it take to be able to do that? For example, is it at different ministerial level or non-WaSH NGOs, private sector, other actors as well? So we'd like to hear a little bit more about how you're actually doing that multi-sectoral or cross-sectoral working.
I think for us, I would first talk about the advantage, I guess, is like, WaSH, it's something that is a priority within the government system itself. And there is the Right to Education Act, which in which access to better WaSH facilities is a guaranteed provision. So I think for us to work with the government, it has been in some ways been easier to pitch it in terms of the need for the interventions that we have been doing in the past. I think a very good result that we had was when we first initiated this work about 6 years ago, was developing the first hygiene curriculum module that we have been using, the hygiene training module, which has been used to a point where in 2018, we had trained about 2,000 plus teachers of government schools using the curriculum. But this curriculum was developed in collaboration with the government. So when I say government, this is the state's education departments, the authority that is responsible for the 2,000 plus schools in Kolkata. So we have been working with that particular department, and they were the ones who had we jointly put together a committee where there were people who were representatives from their pedagogy department, some retired teachers and administrators who were part of this committee who helped us develop the hygiene curriculum. So this was looking at how while the hardware can be provided by an organization like us, but at the same time, when you're trying to ensure that those are being maintained and managed better, how do you go about doing that, and what role a school plays? So that's something that we have been able to work for a period of time, over a period of time. Also looking at building capacities at the grassroots, wherein you have your water filtration system, for example, that we provide as part of our project. And we do commit for a couple of years of its maintenance so that the schools are able to later on do that, like, and how can we make that more cost efficient, and at the same time the supply chain is available, local resources are available to be able to maintain it when splash exists. So I think that way we have been looking at, as I said, building capacities locally of local technicians and plumbers to be able to address that element. But I think, as I said, I would say we have been fortunate in the sense that while there has not been upfront funding support yet, which we are now pursuing, but there has been a lot of interest and at the same time facilitative support, and we have been able to use the government resources in terms of human resources to help kind of, do the outreach work, some of the work that we have been doing.
Great, thank you so much, Dora. A really clear response there and a multifaceted approach that you're taking. So taking a look at the questions in our Q&A, I can see that there are several very popular ones. So I can invite the rest of the audience, just take a look at the Q&A box to see if there's anything else you want to add. And we'll pause a moment while you read. And if you want to vote for any of those additional questions, we can address those as well. Next then, it looks like the top question is for our colleagues at CRS, Catholic Relief Services. And the question is, I'm interested in how the clean clinic approach engages the health sector and health actors as part of the roadmap. Have you found challenges in getting them to prioritize this issue, and how have you addressed it? So that's a good question for Francois and Bezout. Over to you guys, please.
Oui, merci beaucoup. C'est vraiment une très bonne question.
Thank you very much. Yes, it's an excellent question. In the clean clinic approach, we did indeed encounter enormous challenges with regard to the functioning of systems and itself or themselves. I'm going to give you an example of Madagascar. When we launched and integrated the clean clinic approach in Madagascar, we went over the entire health infrastructure on a national level, regional level, and also in the districts and local. And what did we notice? First of all, we wanted to understand whether the WaSH system was functioning well in the health facilities. But strangely enough, we actually detected that the WaSH systems that was developed by the Madagascan government and the WaSH policy within the health systems, which was supported by the government Madagascan authorities or in 2008, in fact, they've not been able to advance since then in implementing the program. So they have policies, they have the institutions, the mechanisms, a responsibility or is in place with the role of each party, but all of these pillars within the system are just kept in a drawer somewhere. They are just not implemented, and that was the first challenge. So to overcome these challenges and to resolve these problems, we started by having a workshop, a training workshop on a national level to retrain the training team, the national training team, and now the national team must go and train the regional teams, and the regional teams will then support the various districts of the country. So this is what is happening at the moment, and it's going well. And the policy that had been in a drawer all along is now busy being implemented, and it's being materialized. in the field. The second challenge, again, with regard to the stakeholders, is that on a local level, we found that the health systems in the centers, the health systems, were not able to draw up action plans to improve the conditions. And with the tools and the approach, the clean clinic policy that we had integrated, this had become possible. So now all the health centers and facilities that are being supported, whether it's public centers or whether it's private Catholic centers, they have now got the action plan together with the support of the districts and the CRS, and these action plans are today busy being implemented. So they are very satisfied in this regard because they themselves are busy wondering or saying to themselves that they are actually able to do it. And why don't we do it? Or didn't we do it? So this is how that the clean clinic approach was able to contribute to the health centers of the government of Madagascar. And the very same approach was also applied in the DRC with the Catholic clinics. So today, all health centers, Catholic health centers, have their action plans. They organize meetings on a regular basis to review the progress of the indicators, and where things are not working well, then they put in place certain strategies and corrections. So this is briefly what I have been able to say. I think Bezout can also provide some other elements because he, of course, is directly involved in Madagascar. And Bezout, in fact, is busy following the district teams in order to rehabilitate and construct the wash systems within the health centers. Thank you very much, Francois. The most important thing in the action is to the setting up of approaches and centers, which was never actually done before. But with this clean clinic approach, we could advance, and I'm afraid Bezout has been lost. But now, with the participation of various actors, they were able to budget and to respond to the various needs. And with the aid, the external aid, but they have now the available budget to accomplish all their tasks. And the activity is starting to bear fruit because there are health training workshops, because they are being implemented and they are successful. So this is going to be continuing at present. And just to complement what Francois has just said, there is also collaboration with the municipalities, the communes, because there was never any wash training in that regard in the community. But now we have an action plan that has been put in place. There's also infrastructure, and there is now a beneficiary agreement. And the community is now entitled or may collaborate and play a role in the improvement of the wash infrastructure. But we do believe that we are on the right path. In the improvement of the wash systems. I'm afraid the connection of Bezout was not always very clear.
Thank you, Natalie. So thank you so much, Bezout. I know we lost you a few times there, so the translation, the interpretation may have been a bit on and off. So, but I think we got your key points, and actually you started to address one of the additional questions that has been prioritized, which was around holding governments to account. And I picked up from what you were saying there that that's also been supported by the type of collaboration that the work that you've been doing focuses much on collaboration with municipalities and communes and developing those joint action plans with communities, the beneficiaries, so that they can also hold people to account. So I think you've actually started to answer that one for us to a degree. I might come back to you there. But this next question as well, I'd like to pose to Dora in terms of obviously your work with schools. How have you been able to hold governments accountable to their commitments? You mentioned the Right to Education Act, which has WASH embedded in that, but how have you actually encouraged people to take that policy up, take that act up and put it into practice, especially, as there's been an additional point made here, in the context of governments having to suddenly deal with newer priorities and other cross-cutting issues as something like a global pandemic. So Dora, do you have any thoughts on this one as well, please?
Yeah, I think it, again, we've taken this and so maybe just to look at the design, program design itself. One, of course, has been the direct engagement with the department itself, but then looking at the school as a unit and its administration, who are also indirectly really government employees, like, you know, these teachers that are, or the school management committees are essentially in place as part of the government machinery. So, and the Right to Education Act, like other items, they have what they call the school management committees, which is a mandate, and it's a group of people who are essentially key stakeholders, including the local government representative of that area, who is part of that school management committee, and they have specific roles in place. What we have been able to do is, and this was I think a lot of credit goes to our field team, is like the child cabinets, again, which is sort of, it's like a parliament. And these child cabinets, every school is supposed to have one, who are essentially, and these are student leaders who have roles like a prime minister, or education minister, a health minister, specific portfolios with specific roles. So our inputs, our training has been looking at get them to sort of bring in the WASH agenda as part of their larger demands that they make to the school management committee, and how then that sort of ensures that, you know, they are accessing what they can. So say, for example, in a particular school, they were having problems with the disposal of garbage. So the child cabinet wrote to the local councillor saying that you have to arrange for garbage collection on a regular basis from our school as we are suffering. So then, like, you know, this went in as a demand from them, and then the local representative had to ensure that there was garbage collection happening, just as an example. Even so, like, for example, the water connections are supposed to be provided for the municipalities. So the schools are now going and demanding for additional water supplies to allow them to manage their toilet facilities better, or that they have steady supply so that the drinking water, there is no disruption with the drinking water facilities. So I think that's where we have been able to work and hold people accountable, not directly going on a more of a activist mode, but getting these students, lending them a voice and allowing them to, that platform, to be able to sort of, you know, plan and decide and as to how they want to take it forward. And we are seeing results, like, you know, and we have noticed that where the school management committees are active and they are they really have good intentions in place, they have been in turn able to go to the department and seek funding for certain elements of the, you know, work that we are doing, including, say, for example, supporting the sanitation work that we are doing. So this is happening at a school level, but when you look at the 1200 schools, then it is something that has to come more centrally, which is from the Department of School Education. And that's our next goal, as in looking at more sort of a defined core contribution in financial terms to the project over a period of next 3 to 5 years.
Thank you very much, Dora. Again, very clear, and the different approaches that you're taking there to support accountability, both with the pupils and teachers and with the, well, the child cabinets, sorry, for the children, and also these parliaments, and also the school management committee. So really using those platforms and those existing systems to promote accountability. Now, there are two questions that both have 5 votes each, but I'm going to come to the one that's specifically addressed to our Cambodian colleagues, because we haven't heard from those in a while. So over to Geoff and Sovattha. We have a question here from Hannah Crichton-Smith, which asks, what factors do you think led the government of Cambodia to institutionalize the Civic Champions program? Has the government agreed to finance the program using its own funds? Is this commitment to institutionalize the program being questioned in light of COVID and the immediate need to finance the emergency response? She also apologizes for popping a lot of questions in one there, but if you could like to take a couple of those within that set of questions from Hannah, that would be great.
I think Jess would like to get this one. We chat at the back.
Go ahead, Sovattha. Go ahead.
I would like to respond quickly about why government are interested in this and why government would be willing to fund this. I share my response in short. One, we share the same reason and we share the same goal. In our case, it is the implementation of the decentralization and deconcentration by government. So government is implementing the function transfer to local government, specifically on water and sanitation. And their key challenges is capacity of the local actor. And in order to perform that function. So we came at the right time with the right tool. Second, it's cost effective. Cost effective matter in this point. Just today, just before this meeting, during noon, I was talking to the 2 ministries in our collaboration meeting, actually also with WaterSHED, because we are doing this together. And we were discussing about how much would it cost for government to cover the program after WaterSHED is leaving, and what benefit to their local actor. And we were also discussing how could all the data we offer to you would be credible enough for you to believe, because we don't want the result coming from WaterSHED or WaterSHED, but we want the result of the study coming from their key ministry staff. So we have their team working with us in an M&E team to conduct that study and respond back to their own boss. And we believe that that would help changing the way of their thinking. Thank you. Geoff, would you like to add something else?
Only very briefly, yeah, I think that's a great point. It's the value for money, it's not expensive. And yes, governments always paid participant fees, you know, for joining the program. And now government's also paying program implementation as well, which is great. But I want to add one more factor, which is time. Sometimes that's forgotten about in system strengthening approaches. They're not coming instantly. And the government counterparts we were working with, even decision makers, have been participating in the program for years. And for years, we've been communicating to them that we would be handing over along this timeline. And for years, we were showcasing the results and the changes of individual participants and the changes that followed them for years after. Well, really over 7 years, slowly, champions within government counterparts emerged. So definitely an investment of time too, but worth it for the sustainability factor. Thanks for that question, Hannah.
Sorry, can I raise just one quick point about the cost? It's extremely cost effective, as we said, but we just would like to emphasize that it's $23 for the program cost in order to build one latrine. by the community themselves. And more detail, we already conduct the cost-effective analysis of our Civic champion last year, last iteration. So please go to WaterSHED website to explore more. And for this iteration with the government that we do province-wide Civic champion, we believe the cost is cut even more than 50% because everything was paid by government at the local, at the subnational level. Thank you.
Thank you. Thanks, Sovattha. Thank you, Geoff. Some really interesting points there, especially around the value for money, as you both mentioned, and also this issue of time and the time it takes to show impact and to demonstrate that government can also be champions for these kinds of system strengthening and these types of changes. So thank you very much for that. I think actually a related question that is also prioritized here on the Q&A is around advocacy. And the question is, I too would like to find out what advocacy work has been done around COVID-19 response, bearing in mind that collective advocacy is one of the key activities for Agenda for Change, along with developing the evidence base and knowledge sharing. So we have you guys online as some of the Agenda for Change members, and it would just be interesting to hear from your experience if you have been able to do collective advocacy at the national level with any other members of Agenda for Change. I know we have some other members online with us. Obviously, we just heard from WaterAid, we've heard, I think, from colleagues at Sovattha. So it would be interesting to hear perhaps first from Dora, if you have any thoughts on this in terms of advocacy and how you're able to do that collectively with Agenda for Change members and maybe other organisations too, of course. So Dora, perhaps could you try to address that one?
I think, again, here in India, there is a collective of NGOs known as the Right to Education Forum. So this is where different issues pertaining to, education, rights of children come together. So currently there is two very important things that this forum is dealing with. One is, of course, and I don't know why, the National Education Policy was just announced last month, which was not the best timed, I would say, given the pandemic and everything else. And this is currently something that, the various organizations are kind of discussing, like in this particular group. And it's a national issue now, and people are talking about it. But I think in terms of the COVID response, I'll be honest, I would like to see more collaboration, but unfortunately that hasn't happened till date. And especially for us who are a school-based implementation agency, we have really had to take a pause in terms of our actual work and kind of, go back to the drawing board and start revisiting how we are going to do our intervention in the first place, wherein it's not going to be the same as what we were doing in 2019. This model is looking very different. Well, the infrastructure, yes, even within the infrastructure, there is tweaking required. So yeah, if there has been a concerted effort towards doing advocacy, that hasn't happened, but definitely once you know what, and again, we are still waiting for the Ministry of Human Resource Development to be sort of sending out the SOP in relation to school opening. It's still not there. So, once you have that, I think agencies are also going to be in a better position to look at what needs to be prioritized and what we should be advocating for, if that answers your question. I don't know.
Thank you, Dora. And then just to ask Bezout or Francois, did you have anything to add to this question about collective advocacy, or if that's actually happened in DRC or in Madagascar in your context, and how you're able to engage with other organizations, whether they are Agenda for Change members or not, how you've been able to do any joint advocacy work around COVID-19? And in your case, WASH and healthcare facilities. That might be a long question to translate. Obviously, I've just got the English channel on, so I can't hear how that's going in French. But Francois or Bezout, would you like to add something on that?
Yes. Can you hear me? He's asking. Right, with regard to advocacy, like it has just been explained, there has been advocacy in the communes and with the on a national level as well. In Madagascar, a wash system is a bit neglected. So we have already done some advocacy actions with regard to national actors, but there are also regional actors and district actors. And as I explained earlier, in principle, we go with the inspectors to the districts to implement the wash infrastructure, because the commune has a tendency to let things go. And the health centers are then put in place with the inspector to have some advocacy actions with the district members and local members, and for the sake of the beneficiaries of the system. And this is what we will continue to do. But the commune or municipality also contributes. And of course, advocacy is carried out across the country, because it is something that is required on all platforms, platforms where we can collaborate and where we can implement some activities as well. So it's important for us to get ahead by means of the of advocacy with higher institutions or with the prefects of the region, of the district. So this helps us a lot in advancing the systems. I don't know if Francois has something to add with regard to advocacy. Yes, thank you. With regard to Madagascar, I would like to add that when we explained the importance of resolving problems, systemic problems, instead of carrying on with actions that are fragmented, separated, disjointed activities. So today, for example, in Madagascar, the Ministry of Health has taken the lead to organize meetings, coordination meetings every month, and to offer information or a room where people are invited. These are representatives from the Water Ministry, and representatives from the Ministry of Decentralization, to discuss together about the issues and to see how they can be resolved. The problems of water, hygiene, and sanitation in health centers in particular, but also the system in its entirety. So we have the wash system, but when we talk about water, hygiene and sanitation in the health systems, that's a different system. And it's very often the system in health centers was forgotten. And when action plans were drawn up, we only saw the communities. And that is why today we found ourselves with many facilities, health facilities that don't have toilets, water, that have no hygiene facilities to be able to offer decent quality services or care. So this work is ongoing, and I think that in the years to come, we will have total involvement, and we will even have a financial commitment from the government. Thank you.
Thank you very much, Bezout and Francois. Now I know we just have about 6 minutes left, to be precise, during which we'll want to hear a little bit more about Alec and what happens next with this systems learning exchange. But I would also like to very quickly go back to a question that we asked our panelists in advance, and for a very rapid round of responses, as we'll have about 30 seconds each at the max. But one question that we wanted to ask was around how Agenda for Change is really hoping to demonstrate how a systems focused approach can help to prevent and more effectively respond to future outbreaks, epidemics and pandemics. So if you had one thing to say, what key piece of evidence do you have that could help us all make that case? So first of all, over to Sovattha, maybe. I'm going to pick you all one by one and hope you can answer this very complicated question, but with one key point in about 20 seconds each. How about it? Sovattha, would you like to try first?
Thank you. So the question is about how Agenda for Change demonstrate how system-focused approach can help to prevent. Okay. So I was surprised a bit when a lot of pronouncements were made in our sector colleague that COVID showed the importance of investing in water and sanitation. It lowered our credibility on all previous claims about the importance of water and sanitation. And the burden from disease caused by inadequate water and sanitation is bad enough. We don't need to make unfounded claim to heap on top. The thinking about systems and enabling environment for sanitation and water have evolved a lot, but not for hygiene. So A4C members should be challenged to help advance the thinking for hygiene. How do campaign better promote the building block of sustained hygiene practice? What can WaSH develop agency do to strengthen the local actor to enable hand washing, go beyond promoting hygiene, and even go beyond supporting local actor to promote hygiene? Thank you. Geoff, would you like to add something else?
Well, it's not evidence that we have. I mean, you know, you're asking me to pick one thing, Tracy. I guess related to what Sovattha said, the system thinking that underpins like enabling hand washing. There's the clean clinic approach Lindsay Denny asked about for CRS. That's a great example from what little I know about how that kind of systems thinking, looking at all the complex factors that result in the outcome we need and we should really have in a healthcare facility. That's a great example. And that kind of evidence, I think, needs to be blown up if it's what I think it is. And it sounds like a great example. Save the Children, CRS, and others have taken it to a number of countries. It links a little bit with what we know about civic champions. And I think that strengthened local officials can do a lot more than they have done in the past for hygiene. And that's the best thing we've got in terms of the work that we do in WaSH for preventing pandemic, as far as I know. Thanks.
Great, thank you. And I realised it's going to be very difficult to all answer this question in the remaining time. So I'll ask everyone else to submit a written answer for this question, because I know people are interested to hear more. But next I'll hand over to Alec. Oh, sorry, no, thank you. Really good answers. And I think this focus on hygiene and having that as a sustained practice is a very key message, and how we bring our allies in at such times. So Alec, would you like to lead us through the next few moments? I realize I've left you barely any time, so many.
That's okay. I think the most important piece we'd like right now is I'm going to open a poll for those of you that are still here. As this is the final webinar in our Systems Learning Exchange series, we are trying to figure out other methods of communication for the WASH system actors to stay in touch with one another and to share learning and evidence. So while I'm speaking, if you can go ahead and submit your vote. And I should add that I will also include this in a follow-up survey about how the webinar went for everyone. As far as other ways you can share with us, you can always send us resources. If you have resources related to strengthening WASH systems and institutions, like we heard about today, I would be happy to put those on the website. We also offer Twitter takeovers for those of you that would like to come onto our account for the day and share learning or evidence. And we also offer interviews that I can do with you. Right now, we're looking to share case studies on COVID-19 and WASH systems, specifically where your organization has used a system strengthening approach that has resulted in resilient WASH service delivery. So if you have examples of that, we can also send you a template that you can fill out. We would love to share those experiences with others. And finally, since this is the final webinar in the series, I wanted to just make you aware that there is a dedicated website. It is washagendaforchange.org/learn. And that is where you can find all of the recordings of these various webinars, and also the speaker videos and their topics are all posted there. So if you will visit the website, you can also subscribe to our mailing list, etc. I think that's it. I realize we're over time. Thank you very much to our speakers for today. It was great to have you, and also to our facilitator, Tracy, and our interpreters for making this more inclusive for other language speakers. And finally, to our captioners. Thank you guys so much. You made this a really great event for everyone.